the other panel still hasn't joined us, but we'll get started for now. So if Julia and Haley, you guys can introduce yourselves.
Yeah, hi, I can go first. I'm Haley Huntington. I am from the American Cancer Society. I am the co-lead of the National Campus and Youth Engagement Team. I've been with ACS for almost 5 years now.
Hi, everyone. Good morning. My name is Julia Madnick. I am the Youth Services Program Supervisor at Mission Neighborhood Health Center. MNHC is a federally qualified health center in San Francisco, providing primary care. And I oversee all of our youth services, including our confidential sexual health teen clinic, as well as our after-school program for youth.
So I have some questions for both of you. Miss Haley, what is the biggest challenge in the hospital or workspace at the moment?
Yeah, so I mean, with how crazy the past 2 years have been with COVID-19, and I know unemployment is weird, and it seems like there's a lot of untrust about things about health and technology. We're having a very big problem with just healthcare workers, either healthcare workers that are very, very stressed and overworked. We saw a lot in 2020, a lot of people who left the healthcare or the hospital or like clinics because they were overrun, and I don't blame them. I'm not a person who works in a hospital personally. I work in public health. But I just know they're super, super stressed and overworked. And coming in again in 2021, we're having waves of COVID again, even after vaccinations and all those things. Yeah, healthcare workers are super stressed and overworked. And we're seeing kind of instead of nurses and doctors coming in and graduating, not many people are going to the healthcare field just because it's a hard field to be in right now.
Absolutely. So what do you think we can do to help everyone recover from the pandemic?
Yeah, I think our world has absolutely changed with the pandemic, and I think things will stay the same. I'll talk a lot about the healthcare in the cancer setting. But here at ACS, ACS's big mission is to fight cancer in any way possible. And ACS has patient services and provides screenings and treatments and free rides to care, and a 24/7 hotline that people can always call if they have questions about cancer, or if they're a caregiver, or if even they're a family member and they just have questions about cancer. And we saw an influx of people calling into that 24/7 hotline because they just had so many questions about COVID, and they didn't know how it would be changing our world. A lot of things that changed in the healthcare industry were with all the lockdowns and the influx of hospitalizations, hospitals had to cut clinics or specialized clinics. And a lot of cancer patients weren't able to get those crucial screenings or even their treatment, unfortunately. And I don't have the super numbers, or I don't have the distinct numbers, but there are a lot of people who were able to get their screenings. And so they got diagnosed at later stages. And that definitely changes your survival or your timeline of having cancer. If, say, I'm a person who is at stage 1 cancer, but I haven't been screened and I don't know it. With COVID, my clinic was locked down for a whole year. I wasn't able to go to that clinic and get that mammogram or pap smear, any of those crucial screenings that people typically get every year. And so if I go a year without those screenings and a year without that diagnosis, maybe I'm at stage 2 or maybe I'm at stage 3. And if you know anything about cancer, those higher stages, stage 4 is kind of the worst stage you could have, unfortunately. So American Cancer Society is doing the best they can to return to normal and try to promote people to get back to screening, get back to treatment if they feel safe, get a vaccination. We know that vaccinations for COVID-19 are safe for people who are immunocompromised unless you have something super specific and your doctor tells you not. But yeah, a lot has changed, and at the American Cancer Society, we're just trying to get back to a normal and get back for people to be healthy and safe and try to revert back on what we missed in the past year and a half.
The next question is for Miss Julia. So, what are common misconceptions people have about the pandemic, and how can we combat those misconceptions?
A great question. Thank you. I think that within the primary care setting that I'm working in, we do talk a lot about vaccination. And I think the COVID-19 vaccine especially does have a lot of misconceptions, right? A lot of people are maybe confused or unsure. They've heard lots of different things from lots of different places about the vaccine. And not everything they hear on the internet may be true. So I will focus more on like vaccine misconceptions. And in my work, especially with teens and young adults in San Francisco, I actually find that the biggest reason for vaccine hesitancy is really just like not thinking it's important, right? I've talked to multiple patients who they're maybe not vaccinated yet. They're in that age range of like 17 to 25, which is right now they're like the second lowest vaccination rates of any age group in the city. So, in talking to those people, they're not worried like, oh, the vaccine will make me magnetic, or they're not worried about a microchip or anything like that. Really, the thought is like, oh, I'm a young person, I'm healthy, if I get COVID, I'll be fine and I don't need it. And I think that's the biggest misconception. That's the reason why a lot of people are not taking the vaccine when they should, because they just, might not think that it's very important if they're young and healthy. But, in reality, from a public health perspective, we know that everyone who is eligible in a population should get the vaccine in order to not only protect themselves, but also protect their community, right? Haley was talking about healthcare workers being stressed and overwhelmed. And right now we're seeing unvaccinated people hospitalized for COVID at much higher rates than vaccinated people. And that is only going to continue putting stress on our healthcare system. So I think that when we're thinking about misconceptions, we really need to look at like, why are people not getting vaccinated? What are they thinking? And really what I've seen is that, yeah, they just think like, it's not important, if they get COVID, they'll be fine. But we live in a very like interconnected world, and what one person decides, if like one person deciding not to get vaccinated could actually contribute to, the further spread and mutation of the virus within our population.
The next question is, what have you done to combat the pandemic?
So within my organization, we have really had to try to combat COVID on a few different levels, right? We were always trying to adapt as we learned more and got more information about what COVID is and what we can do to prevent it. Early on within the primary care setting, we did try to do as many services as we could over the phone to prevent patients from having to come in to their appointments in person. We still are offering some telephone visits, for example, like therapy and behavioral health services are still being completed over the phone. So we tried to adapt that way to decrease the risk. We also became a community testing site to test anyone in the Mission neighborhood for COVID-19 if they needed, as well as a community vaccination site. So as we've learned more, we've sort of figured out how we can adapt and how we can continue supporting our patients and our community. We also hired a contact tracer whose job it was to call people who had tested positive for COVID and help them and their close contacts to isolate or quarantine. And we've really also looked at like what we can do to keep people afloat, right? When we had such, especially early on, unemployment numbers were really high, and I think people were just having a really hard time. Kids were home from school. You know, I'm sure a lot of you know that was like a really stressful and difficult time, especially early. And so we've really looked at how we can sort of get more resources and get more help into the hands of the people who have been the most impacted.
The next question is for both of you. So what is a problem caused by the pandemic that hasn't been highlighted as much or is unknown to the general public?
This was a tough one. This is a great question, I think. And I'm not sure what you think, Haley, but what came to mind for me was the mental health impacts of the pandemic. I feel like it's something that we talk about like within the general public, but it's not always discussed in like a very productive way, I don't think. You know, I was reading a study a couple days ago saying that like depression rates in older adults are like twice as high as they were before the pandemic started, and that is especially apparent in like lower income or non-white adults. And so I think like this has really taken a toll on our mental health, and like in our society, in the public in general, we don't talk about mental health very much. So I think that would be my answer, is like this really took a toll on like not only our physical health, but also like our emotional health, our social connections, our social relationships. And we need to do a better job of like talking about that and figuring out how we can keep supporting people.
I love that answer. Yes, Julia. And I absolutely agree with that. One of my capstone classes was a public health class, and the teacher wanted to talk about mental health in the pandemic. And it has absolutely changed. Mental health is something that's not really like researched well. They haven't figured out how to track anxiety, track depression, other than like prevalence rates, and asking people like, have you felt symptoms of anxiety in the past year? But hopefully in the next decade or so, they'll get better with all that research and stuff. But you know, we've had to absolutely change our lives. Our lives are, well, right now we're on Zoom because we can't really be in person, right? Because we want to stay away from possibly getting COVID. And we would probably be in person if there wasn't the pandemic. And we've had to adapt. I know I took 2 years of online school, as do many of you, but some people haven't been able to adapt to that change. They need social interaction. They need that support system. Possibly if they live with someone who's immunocompromised. I know some people in the pandemic had to move homes so they didn't have put other people in risk, unfortunately. So yes, I absolutely agree with Julia. Mental health is something that really has been hit hard by the pandemic, and I think it's kind of here to stay. People still feel symptoms of anxiety. I know I still worry about COVID on a daily basis in my workplace, in my job, with my friends. And so, yeah, I think that's something that we'll definitely need to tackle. Either that's with clinics or doing like a wide like public health implementation of some sort, but just making sure that people's physical health with COVID is good, but also your mental health is super, super important.
Someone from the audience asked a question for both of you, and that question is, what is something good that came from the pandemic?
I think we've absolutely realized how important technology is. I'm a computer science person, just like all of you here, and we can utilize technology in way more ways than we have been. I know there's a lot of workplaces that are not up to date in their technology, aren't up to date on their security. And now that we've been thrust into an online world because of COVID and social distancing, people are realizing how much more we can do, how more efficient we can be with technology. So I'm excited to see how our world changes with all of that, and people are thinking how to use technology in a different way than we were before. A lot of jobs have been pushed remote, and I think that definitely, I think that it will definitely be here to stay. A lot of people like working remote. Some people like those online classes, some people don't, which is absolutely fine. Pick what you most like. But I think people will be able to have a more flexible work-life balance and stuff. So it'll be interesting to see with technology.
Yeah, kind of jumping off of that, I think COVID has definitely showed us that we can do more to make the world more accessible for people who may not be able to like go to things in person, for people who have like limited mobility. We have kind of demonstrated that it was rough at first, but we were able to sort of get that technology up to what we needed it to be, to make it so that like physical space didn't matter as much. So I do hope that we, continue all those changes that Haley was talking about, using technology and really keeping in mind, like, there are a lot of people who may have been stuck at home, unable to move around as easily far before COVID was even something that was in our minds. So I do hope we continue that. I also think that with the distribution of the COVID vaccine at no cost to every single person in this country, regardless of immigration status, everyone who's eligible, I think that has also demonstrated like we can and should do more to protect the health of the world, especially people living here, because our health is so interconnected. And if we can provide a vaccine for free, like how else can we push the healthcare industry to provide other life-saving treatments for free as well? So I think that like spurring that conversation has also been an unexpected positive of the pandemic.
Okay, thank you. Those are all the set questions, and also plus one question that the audience had. So now we can open it up to everyone to ask any questions that you guys have. I guess I can start. So what was something that has motivated you to join the organization you guys are in now?
I can hop on that one. So I'm with the American Cancer Society, and my personal why for joining ACS was because my mother actually passed away of breast cancer when I was only 11 years old. I was in elementary school, and I really didn't even understand what cancer was. My dad always told me she was sick, and it's hard to describe to a child what cancer means. It's complicated and it doesn't make sense. And it's frustrating for a child, and even for adults too. And throughout the years, I've grown with that, but also I've had other family members who have been diagnosed with cancer. Some have survived and some more have passed away. I have a whole list on back at home of all the people who have been touched by cancer. And for me, I would love to fight with an organization that is trying to change that. And hopefully in the years to come, even when I'm older, I won't have a growing list of people who have been touched by cancer or other chronic illnesses, because it's destructive and it's hard and it's frustrating to lose loved ones. So yeah, I would love to one day never have to tell one of my family members and have to deal with cancer in the future. So that's why I joined ACS. Being with ACS has been very positive for me with all of my family members who have had cancer and stuff. I have met other people who have been impacted by cancer, or people who haven't been impacted by cancer directly and just want to join a public health nonprofit that is trying to make a difference in the community.
I joined Mission Neighborhood Health Center just over a year ago, and I think what made me excited about this organization was that we are very rooted and trusted within the community, and we provide care in English and Spanish to people who need it. We don't turn people away from necessary primary and preventive healthcare, and that's something that's really important to me. I also love that in my role, I oversee our program, so I make sure that like in the background everything's running smoothly. But I also have the opportunity to work closely with the teens that come to our clinic and the teens that are in our program, and that's definitely been the highlight. What like really made me excited about the position was that I think that like it's always so impressive to see teenagers in my community that are really like working hard and trying to figure out solutions to problems that y'all see. And I love to be able to like be a part of that and just sort of encourage that excitement and that passion to try and use your voice, because you definitely have a voice, to try to solve problems and be, part of the solutions. So I'm really excited to see like what you all do over the next couple of days, and I'm sure there'll be lots of great ideas.
Yeah, so I see that in the chat, people have asked questions. So do you have any advice for our hackers and coders for today?
I did a few. Oh, Julia, do you want to go?
You can go ahead.
Okay. I did a few hackathons a couple of years back. I'm trying to think of some good advice and stuff. I know on that when I did hackathons, it's super fun, and you're gonna have so many ideas that you're like, oh, I want to do this and I want to do this, but it's hard. You can't over the course of the weekend, like you want to tackle everything, but with a time crunch, I know it's hard. Start by making lists and really thinking critically, how can you help? Maybe it's a personal problem, or just like talking to other people or around you guys, and yeah, just bouncing off ideas, I think, is the best thing I would recommend. You might start with one idea and it can change completely into something super, super awesome and workable. Good luck to all you guys.
I also would say like, don't feel like you're like stuck in these 2 days, right? Like I'm sure there'll be lots of great ideas that will hopefully be pursued like next week after, this is if y'all are talking about like COVID recovery, like this is something that will be ongoing. So if you all end up with like a really great idea, talk to adults, right? Like talk to your teachers, talk to your school, talk to like any other like organizations that you're part of to like keep it going, right? Like as an adult who works with young people, like I will always like hype you up and like listen to your ideas. And I would definitely encourage you to like find, talk to people about those ideas. Like don't let it just like end tomorrow.
Another question in the chat is, what advice would you give your younger self at the start of your career?
That's a great question. I think I would have told myself like, don't be discouraged. Going from like school to like applying to jobs for the first time is very stressful and will lead to a lot of disappointment and bad news sometimes. So I would remind myself like, don't be discouraged, you didn't get that one job, but that's okay. You're gonna end up somewhere that's like super cool and you're gonna love it.
I would tell myself something kind of similar. Don't be afraid of change. I know in college, I changed my major 3 times. I think like the average college student changes their major like 6 or 7. And it's crazy. And when you're making life decisions about your career or your passions or your hobbies, yeah, it can be stressful, but don't get discouraged. Change is always great, and the more you learn and grow up, you'll learn where you want to be in a community, what you want to do to make yourself happy. So make sure you stay patient with yourself and always have a positive outlook on any sort of change you guys have.